What happens during a cruise ship medical evacuation? Have you ever wondered what happens if a medical emergency occurs on a cruise ship? It's a situation no one wants to face, but knowing the process can ease your mind. When a passenger or crew member has a serious medical issue that cannot be treated on board, a medical evacuation is initiated. This is often referred to as a medevac. First, the ship's medical team will evaluate the individual's condition. Cruise ships are equipped with medical centers staffed by doctors and nurses who can handle many emergencies. However, if the situation is critical, like a heart attack or severe injury, the medical team will request an evacuation. Next, the ship's captain contacts the cruise line's Emergency Operations Center and the appropriate Maritime Rescue Coordination Center. This is usually managed by the Coast Guard or a similar authority. These agencies work together to coordinate the evacuation, ensuring that all safety protocols are followed while minimizing disruption to the ship's schedule. Depending on the ship's location and weather conditions, the evacuation is typically carried out by helicopter. The helicopter will either land on the ship's helipad or hover nearby while the patient is carefully transferred onto a stretcher. If the ship is close to shore, sometimes a boat is used to transfer the patient to a port where local emergency medical services can take over. Once the patient is evacuated, they are taken to the nearest hospital for further care. Often, a member of the ship's medical staff will accompany the patient to ensure continuity of care during the transfer. Throughout this process, the cruise line keeps the patient's emergency contacts informed and provides updates. The crew also manages communication with other passengers to maintain calm and order during the evacuation. From a travel perspective, this highlights the importance of having travel insurance that covers emergency medical transport. Unlike rail travel, where emergencies can often be managed at the next station, cruise ships operate in remote areas. This makes having onboard medical facilities and evacuation protocols essential for passenger safety. In summary, a cruise ship medical evacuation involves assessing the patient, coordinating with rescue authorities, transferring the patient via helicopter or boat, and handing them over to land-based medical teams. Understanding this process can help you feel more prepared for your cruise adventure.